Thank you so much for joining us, Minister. So we've
Thank
really
you.
seen how badly hit Chhattisgarh has been, along with the rest of India here. But with the tone falling, are you seeing light at the end of the COVID tunnel, or do we have to wait for more data which gives us a true idea of the extent of the pandemic in rural areas which have really not been perhaps surveyed or tested as much as other places?
There is always room to be more careful, not be complacent. If figures have dropped, positivity rates have dropped, if our active cases from about 130,000 have come down to 33,127, yet there are 33,127 active cases in Chhattisgarh even today. So that is a large number, a number which could go either way. It could continue the slide to lower positivity numbers and lower active cases, or it could take off again. So there is no scope for complacency. We need to adhere to the three cardinal principles of hand hygiene, physical distancing, and wearing of the mask, and going ahead on the vaccination drive, where there is an issue about the availability of the vaccine. So there's no scope for complacency. This is a virus, the nature of which we all don't really know too much, and to be able to predict is extremely difficult. So caution and hard work.
No room for complacency, and some are already saying that we could see a third wave. How prepared are you for that?
We have our protocols, we have our procedures, we have our human resource in place, whatever limitations it has. What we met with during the peak of the second wave was a shortage of ICU beds, with a large number of the population adopting for home isolation. About 90% of the population has been adopting the home isolation procedure. So the pressure on COVID care centers, these are the centers where people with lower degrees of infection, low viral loads, they come and they stay. If they don't have facilities at home, they would come here and they would be accommodated here. Then there were beds with oxygens. And then as cases were more serious, you go up to the ICU, intensive care unit level. There we had a shortage. We were very short of ICU beds. And that is one place, one area where we need to put in a lot of more infrastructure.
Right. How much help are you getting from the federal government, and is it enough? What would you like them to be doing to help you indeed to get over this crisis?
As far as protocols and guidelines are concerned, they have been prompt and they have been there to guide us. The health, if it is the state of the federal governments, then we are the agencies who are supposed to implement things. But as people with greater experience and technical knowledge at the national level, they are there to guide us in principles as to how we should do what. So that is the relationship that we have, and there has been no issue. As far as help is concerned, then things go into the financial aspects. If we need to have infrastructure, then you need financial support also. That the more there is that is forthcoming is so much more welcome. As far as other issues,
Minister?
Yes.
In terms of your revenue, in terms of your finances, do you think you need to borrow more or sell assets?
Not sell assets yet, though that is part of the procedure that we are adopting. If we have land banks, we are thinking of using land banks to ramp up revenues. And certainly borrowings we have to do. Without borrowings, with the slowing down of the economy, there is no way in which any government, whether at the federal level or the central level, would be able to meet its expenses. So certainly borrowing has to be there.
Minister, very quickly here as well, just looking at what happened over the last few months, as a politician as well, do you think that this in some way has perhaps lessened Prime Minister Modi's standing in your particular state?
The people have certainly felt left out, in the sense that particularly in the vaccine issue, the decision of the government of India to leave it to the state governments to vaccinate its population of 18 plus up to 45 years of age, that came as a big surprise. It was as if that section of the population, which is substantial, 40% roughly of the population is in this age group. And even a higher percentage among the voting class, since you asked for the voting political aspect. So that was a big letdown. People never expected, after 35,000 crores had been budgeted by the central government for the vaccination program, that midway they would be left to fend for themselves. That was a big surprise. And I'm sure that has affected his image as somebody looking after the whole country and everybody in the country.
Minister, we have to leave it there. T.S. Singh Deo, Health Minister of Chhattisgarh. Before we